Let's get prepared together.
Be prepared.
Hello everyone. This month's emergency prep video is on first aid. And we have with us from the Mill Creek Ward, Captain Bennet Milloy from CAL FIRE. Welcome, Bennet.
Hello, everyone.
So can you talk to us a little bit about the importance of first aid?
So first aid is important to me, obviously, with my job. But first aid is really important to the people that you're helping. So you're obviously the first person that's rendering care to that person. And some of the goals of doing that is to stop further harm from them from happening. So if there's an emergency happening, you can intervene there. And to not become injured yourself or become a victim yourself. Often we'll go to car accidents where somebody renders aid and they are injured while helping somebody out of the car, they get cut or whatever. So
Okay. All right. What are the goals of first aid? What are we trying to accomplish?
So we want to preserve life, and we want to limit the amount of injury that a human being sustains. And then, like I said, we want to not become a victim ourselves, and that is part of preventing further harm to the victim.
Okay. All right. So we're not going to be going over first aid kits today, but everybody should have a up-to-date first aid kit. I know they can expire, like bandages and things.
Yeah. And it's important to have a first aid kit for various things, right? So that's like a great home one. You want one in your car. If you're backpacking, obviously you can make one much smaller, but you should have first aid kits like to the task that you're doing, because not everything needs the same thing.
Okay, great. So there'll be some links in the email about that. What we are going to go over today is real emergency right now first aid. So we've got choking, strokes, and heart attack.
Yes, yeah. Those are the things that will kill you really quickly, and so they are true emergencies, and that's why it's a good thing to focus on them. So the first one you had talked about was choking, and choking can happen to anybody of all ages, so from really little kids that are developing their oral abilities, even to the elderly. Sometimes as we get older, our body doesn't function as it once used to, and so we could choke on things. Well, when those become an obstruction to the airway is when they could be lethal.
So I have a story about that. When our oldest boy was a baby, around the garage, and he was choking. And so I've taken CPR classes and everything. And step one, I think, is just do a quick finger sweep. And we just did that quick finger sweep and pulled out this big piece of apple he had in his mouth, and
yeah,
that was it. That's my choking story.
That's the lowest level. Yeah,
sure, but I knew to start with that.
Yeah. So with choking, it all depends on the age of what we're doing with the child. So for adults now, they no longer encourage the blind finger sweep just because you can get injured, like if the adult bites your finger.
That's why Bennett's here, not me.
But with little kids, if you can see it, if you can see the object in their airway, that's the only time you would use a finger sweep, which often with like really little kids, like babies, you can see they have the chunk of the apple or whatever toy they found on the ground that they put in their mouth. And so that's okay. If you can't see an object, they discourage sweeping your finger back there because you can force that object further back.
Sure.
But so if you have a really little child, small enough that you can pick them up, so you want to pick them up and you would lay them, with their head here, you kind of hold them, and you want to do some back blows. So this is really little, like maybe younger than 2 years old. And you kind of tip them down and do
they're
back
face
blows.
Down.
Yep.
Okay.
And if you do back blows just right on the small of their back, right between their shoulder blades, and you tip them down, gravity kind of forces whatever that object is out. And as you strike their back, it pressurizes their thorax and it forces whatever may be obstructing it out. Wonderful. So if they're much older than that, or their size, so say they're a 5-year-old, but they're pretty big sports player or something like that, you would do the normal abdominal thrust, which is where you'd make a fist, you put your hand on the other side, and you put that fist right on top of their umbilical cord or their belly button, as some would say, and you pull in and up, and you want them kind of close to you, you can do that fast. You can do that for people that are seated. So if we're at Thanksgiving and grandma is choking on turkey in the chair there, she doesn't even need to stand up to do it. You can do it right in the chair.
And the reason we're picking above the belly button is you got to be below the rib cage.
Yes.
You can't be pushing on the ribs. You got to get below the ribs.
Exactly.
And then let the abdominal contents push up.
Yes, so because you have your diaphragm that kind of runs right on the top there, and we're trying to pressurize the abdomen, which will force the diaphragm up, which forces air out, so that pushes whatever the obstruction is that's out. People should know the universal sign for choking, right? Because most chokings become a serious problem because people try and deal with it on their own. So especially the early teenage years, they're embarrassed that they're choking, so they'll run and hide in a bedroom or a closet, which obviously nobody should run. Yeah, they'll run and hide, which is really bad because then don't do that, because then they'll choke in the bedroom and nobody knows.
It's
right?
like drowning and nobody's there watching.
If you believe you're choking, you should immediately give the universal signal.
And look for people.
Yes.
Cool.
So if they're still breathing and coughing, you want to encourage that. That's the lowest level, right? We don't always go directly to abdominal thrust. So if they're breathing and coughing and they're able to talk, that's a good sign because they're still able to move air. You should probably still call 911 at that point. If they're feeling that in their throat, then the obstruction, and they're still able to move air, the very next step is they're not able to move air, right?
Okay.
And so you want to get early EMS started by calling 911, and then they can come and they can do all kinds of things. They have tools that can pull stuff out if they have to. And, but if we wait till they're unresponsive, now we got to wait that response time even longer to call 911.
Sure. Anything else on choking, or should we go on stroke?
No, I think we can go to stroke.
All right, what you have for us on that?
So stroke is another thing where you can make a big difference by being aware of what's going on around you. So strokes are really common, and the sad thing about strokes is they're often reported very late, and the longer you wait to report a stroke and to get care, the worse the permanent damage is to the patient. So we have an acronym that we use at work called Be Fast. And that's kind of one to help you get early intervention, but it starts out with the B is balance. And so that's one of the first things you'll observe in somebody is their balance will get weird. And that's because in a stroke, one side of their body will tend to get weak, and so they won't be able to support themselves. So either they'll lean or they'll walk.
Is there progression to stroke?
Yes.
And this is an early.
Yes.
This is an early progression.
It's an earlier symptom that you may see, and then. They may complain of, so the E is for eyes, so they may complain of blurry vision or that they have double vision and that it's hard for them to see or read. And as we start seeing these symptoms, these should start adding up to you like, hey, something's not right here. Okay. And then the next is facial drooping, and this becomes kind of a later presentation, and that's because, like we talked about, one side will get weak. Well, your facial muscles are no longer able to support themselves on that side, so the one side will sag, the eye will sag, they won't be able to blink and close that eye. Their speech will become slurred from that because those muscles are weakened. And then they'll have arm weakness. So like if you want to lift their arm up, as us, as healthy adults, we should be able to hold our arms. Well, if you lift their arms up, one will fade down and away, and that should be an immediate red flag to you that something's going on. And then like we talked about, the difficulty speaking. So, and then the T is that means if you have a combination of the symptoms, and I would suggest maybe 2 or 3 of them max together, that is the time to call 911 right then. Right. So they really, like for emergency services, we try and get them from time of onset to the hospital and intervention, whether that may be medication or surgery, within an hour. And so sometimes people wait several hours to do that. And some hospitals won't even take a patient that's gone beyond like 6 hours or so.
Wow.
So
they don't want that.
Yeah.
So so Be Fast. That's a lot of acronyms. Like let's say it's a year from now.
Yeah.
And is there just like I've heard real quick? Can they raise their arms, smile, and talk?
Yes.
So some basic kind of.
So those are the things you should really remember, because those are the keys. Because there's very few other illnesses that mimic that. Mm-hmm. And even if you do, so like Bell's palsy can kind of mimic some of that.
But that's not an emergency situation.
But it's not an emergency situation. But even if you go to the hospital for that, it's better to go and be diagnosed with Bell's palsy than to have a stroke and be thinking you have Bell's palsy.
The person with Bell's palsy, they have the facial drooping, but that's the only symptom.
That's their only symptom.
It's not adding up at this point.
Yeah. So that's why I say if you have any combination of those symptoms, you should call 911 right now.
All right.
Yeah.
Cool. All right. Anything else about stroke?
So strokes are treatable. There's different kinds, right? And the longer you wait for treatment, the worse the permanent injury is.
On all these things.
Time is tissue.
Time
yes.
is tissue. I haven't heard that term before.
Yeah.
I like that. All right. So, heart attacks and CPR. What do you have for us there?
So it's a little difficult to demonstrate CPR, obviously without a dummy, but or a mannequin. But the important things to realize is, so heart attacks develop in similar fashion to a stroke. They can either be an air bubble or a clot in the bloodstream, but instead of it being in the brain, it's within the heart. There's some locations in the heart that a block there can be very dangerous, right? So anything that blocks the blood to the bottom side of the heart can result in like immediate death. And so a lot of heart attacks result in somebody needing CPR. That's because the heart has stopped working. And it's the same scenario as a stroke. Time is tissue, right? So the longer that we don't get oxygen to that location of the heart, the more the worse the permanent damage will be. So if you have somebody go unresponsive, right, or you have somebody sitting on your couch and they're presenting with symptoms like they're very pale, they could be sweating really bad, they may feel nauseous, and men and women present differently. Sometimes women will complain of back pain, like between the shoulder blades. And so if they have a combination of those, like as we start adding the symptoms, that's where our index of suspicion should start increasing, right? And it's better to call 911. We can come out and do a 12 lead right there and tell you it's not a heart attack, right?
All right, cool.
Or we can say, no, it's a heart attack. We need to treat you right now with medications. But worst case scenario, if in your home or your place of business, wherever you're at, somebody does suffer from a heart attack and their heart stops working, there's still stuff you can do, and that's CPR. So most people are nervous about doing mouth-to-mouth CPR. They don't want to put their mouth on somebody, which is understandable.
Sure.
But research has shown, especially in the last decade or so, that some of the best CPR you can do is hands-only, because as you compress their chest, there's passive air movement, which is perfusing their brain, perfusing their heart, and you're doing the best thing you can with them, and you never have to put your mouth on them. So that CPR is done the same way as mouth-to-mouth CPR, but you don't breathe for them. So you'd still put your hands on their mid-sternum right here. Mm-hmm. If you feel at the very bottom of the sternum, you can feel like a little pokey bone down there. You don't want to be that far down. You kind of want to be right between that mid-nipple line, I guess is what you'd say.
Sure.
And so you can put your hands on top of each other, and you want to compress the chest at a minimum of 2 inches, or about 1/3, depending on whether they're adult or child, right? So for an adult, that's what you'd want to do. If they're really small, like an infant, you can do compressions with your fingers on their chest in the same way you'd hold them and do compressions that way. Don't worry about the rate and all of that stuff, because if you're doing hands only, there's no 30 to 2 of compressions to breathing.
Sure.
And same with an infant, just keep it going, because that compressing the chest perfuses their brain. And then obviously, if you ever are having to do CPR, you should call 911 to get professionals there to come and do it. Because we have other interventions. We can use medications. Sometimes that heart has stopped because of an electrical issue, and that's when we can defibrillate them. And so,
so let's say it's a year from now and they don't remember all this stuff. Yeah. What's just the basic, like we did with the stroke? What's just the basic, quick signs that they need to do something?
So usually it's pretty obvious. They're very pale and they're throwing up and they're complaining of either arm or jaw pain. So if you have pain, nauseous, pale, that's a cardiac issue, and so we need to call 911.
Awesome, wonderful. Okay, how about contacting emergency services?
So you would think it's very simple to call 911, but there's some stuff you need to know when you call 911. So my office used to be off of our emergency command center, and I could hear the struggles that people would happen. So the most important thing to know is, if available, call from a landline, because that landline is linked to an address within our computer dispatching system, right? Mm-hmm. And so that helps us to know right where you're at immediately, and we can start getting into the questioning or giving you advice of what to do on the phone. So every single emergency services dispatch here in Southern California can provide directions over the phone. So they can walk you through doing CPR if you don't know how to do it. They can walk you through doing abdominal thrusts for somebody choking if you've never done it.
That's good.
They can give you those directions on the phone. Yep. Right. But what's important, so call from a landline if you can, and if you can't, when you call from your cell phone, typically in California it goes to CHP, and then they have to figure out where you're at, and then they have to forward you to that agency. Then people get frustrated because they call and they say, hey, you're choking. They say, okay, let me get you to the... So they forward them, and then they answer the phone. They have no idea what you said to the previous dispatcher, and they say, what's going on there? I told you he's choking. Well, you didn't tell that dispatcher. You told somebody else three agencies ago, right?
There's a behind-the-scene process going on.
Yes, there
here.
is. So be patient with that. Know your address. That's a huge struggle for us. So people get so worked up. They'll just say, send the ambulance, and then they'll hang up. Well, that doesn't get anybody there.
I think the most important thing is don't hang up.
Don't hang up.
Let the communication happen.
Yes. So people think call 911, hang up, and you're good to go. Well, no, we need the information from you,
All
right?
right, don't hang up when you
Don't
call
hang up.
911.
So know where you're at, and if you don't know your address, cross streets, right? Or sometimes, like this happens a lot, where you'll go out to dinner with family, and an emergency will happen, and nobody knows the address of a restaurant. At least I don't. I memorize it.
Sure.
But if you know the name of the address or the restaurant you're at,
Sure.
they can look that up. So if you say I'm at Applebee's in Redlands by Walmart, they know where that is in the computer aided dispatching. So if you can give a landmark, the name of a park, they can still get to you, right? So try and give those clear directions.
All right. And if it's not so clear, maybe somebody can go out and flag them down.
Yes, yep, and that's a great idea. So once you call 911, have somebody meet emergency services on the street. Because even if like you're at a park, you may be on the baseball side, which is on the far side, right? Mm-hmm. So if somebody waves us down, we can get to that location faster.
Right. How about Good Samaritan laws?
So that's a great thing to talk about because most people are nervous, especially in our current society, about getting involved. One, like I don't have a lot of training, or two, I don't want to get sued, right? Which is a real thing you have to think about. The good news is there's federal and state laws in the state of California that protect people that try and help, right? And basically the law says if you operate within your training, which most people have no training, then you're not going to be liable for anything bad that happens. So if you try and do some crazy surgery there, you may not be protected. But if you try and do basic things like CPR or abdominal thrust for choking, that's where you're protected, and that's the intent of the law.
No basic surgery.
Yeah, don't do surgeries.
We'll remember that one.
But absolutely, compressions, abdominal thrust, all of those things that's the intent of that law.
All right, great. How about like CPR classes? Further information for
Yeah, so this is a great thing, and I especially encourage parents, anybody with small children. Most fire departments provide a free hands-only CPR class, and that's the hard thing about CPR. It's like car insurance or fire insurance for your home. You hope you never have to have it, but when you need it, you really need it, right? And so they put them on free. Most cities and communities do it. Redlands does hands-only CPR. The city of Ucaipa does hands-only CPR. And usually they're no cost. You go, or if you want to go like above and beyond, you can actually go get a credentialed CPR card from the American Red Cross, for example. They put on those classes. I don't know what they charge, maybe $20-$30, and you get your CPR card that lasts 2 years. But in those classes, they also teach you basic first aid, which would be like wound care and those things that you could better take care of yourself. And then they can be more age specific, especially if you have smaller children.
Okay. So to wrap it up, any last thoughts?
First aid is huge. It's an opportunity to help other people around us. It's a way to prevent further injury, which would be infection and serious loss. And then in the event of a serious disaster, the government's mindset is kind of the public should be prepared for 72 hours before you see a first responder, right? And so you may have to render your family's first aid or your neighbor's first aid. And so not to scare people, but you should know some basic first aid, because you're not in the event where everybody's calling 911, that means nobody's getting 911, right? And so it may take some lengthy time for emergency responders to get to you.
And we've covered first aid 72-hour kits, and they should have a first aid kit as a part of that program.
Yeah, yep,
All right.
absolutely.
So that's it, Redlands State. We'd like to thank Captain Milloy for coming today and sharing this information about first aid, and we encourage you to take these concepts and work them up in your families, and have a good day.
Okay, everybody, get ready.
Emergency prep, you can do this.